All right, so we are live. Just wanted to introduce His Grace Vaishnav Pran, who's the senior doctor on the GM Health Forum. He has been mentoring me for, we've known each other for 5 years. Is that correct? I think about 5.
Approximately.
Yeah,
Approximately.
yeah, about 5 years. I think I met you in, yeah, it's been about 5 years and a few months now. So pleasure. And you currently are running and really spearheading the project inside of ISKCON and outside of ISKCON for process improvement. And you are basically a process improvement and risk management guru now, as far as COVID-19 is concerned. So no, your efforts are certainly helpful, and you have the personality and patience to be able to go through it bit by bit. And then also we have His Grace Muralidharan Shivarajan, who's also just joined. He is a professor in North Texas, in Dallas, and he is our chief pediatric consultant. Muralidharan Prabhu, we are live, and I'm going to our board review groups and on the KneeTie page, and this is basically it. I just wanted to do a quick introduction. Do you want to present today, Vaishnav Prabhu, your stuff? Do you want to present and then go from there? What would you like to do? Muralidharan, are you on? Go ahead.
Hare Krishna Prabhu, Dandavat Pranam.
Hare Krishna Prabhu.
If you could show your face, it'd be wonderful. I'm not sure, it's early there, but not too early yet. I'm in Texas, right?
Yeah, you really don't want to see my face now. I'm running around in my underwear right now.
Oh, yeah. All right, sounds good. So we'll go ahead and, do you want me to share the screen? Do you want me to pull up your document? Okay, give me a second. Give me a second just to get. So you want to do a run through of this.
Or if you want to go to screen sharing, Prabhu, then I can share the document on.
That's fine. I can allow you to share the document. Is that better? From your laptop?
I'm actually on my cell phone, Prabhu.
Oh, never mind.
So it may be very small on your system.
All right. So let me see. Did you sent it to Go Run Go, I think, right?
Yes, that's right, Prabhu.
Okay, there we go. So you want the flow diagram first, the contact tracing, and flow diagram is the how many slides in the flow diagram?
I think if you're looking at it, Prabhu, it's just the flow diagram is one slide.
One slide.
That's
okay,
it.
Great. All
but
right.
we're looking first and foremost at the SOP, the standard operating procedure.
Okay, so you want the standard operating procedure. Okay, great. We'll put that up. Okay.
Perfect. Thank you, Vinay Chandra Prabhu.
Yeah. Can you see it or no?
Yes, I can see it. I can see it clearly.
Okay, great.
All
right. So standard.
Can you see it? Yes, standard operating procedure for contact tracing in response to COVID-19. Just to share with the team here that first and foremost, I want to thank you all for making yourself available to having a look at this document. This document has been created for the ISKCON temples in respect of contact tracing. Especially, I think in Dallas, you all had an outbreak, and I think Nityananda Prabhu was involved with the contact tracing also. So, with some of our members of the SBS, we actually discussed this document. It's now technically this is our final draft. We're now sending it across to yourself and Muralidharan Prabhu for review and your comments. So that is the context of this document. So first and foremost, I'll quickly go through the introduction, the purpose, objectives, etc. And if there's any additions or changes, if that can be captured, Vinay Prabhu, would that be fine?
Yeah, I could probably take notes. Let me download the document because that way,
Okay.
let me download the document and see if it'll actually open. Let me reshare.
Yeah, it's in Word format, Prabhu.
Yeah. Stop the share and then let's reshare it. Let's see if, there we go. All right, how's that? And then how about this? What we'll do is we'll take everything that's read for the standard operating procedure as far as changes, or should I just make the changes real time? How would you like it?
Real time would be fine, Prabhu. You can do it in red. That
Okay,
would be perfect.
right,
So, can we go ahead, Muralidhar and Prabhu? Can I start?
Yes, Prabhu, go ahead. Thanks.
Okay. So under the introduction, I'm just going to go by line quickly. Contact tracing is a critical component of surveillance to contain spread of the disease. When a probable or confirmed COVID-19 case comes to light, there are three basic elements of contact tracing, namely contact identification, contact listing, and contact monitoring. Are we happy with that before I go to point 2?
Sure. I'm not really an epidemiologist, so okay.
That's fine. So I'll go to point 2. The purpose, the aim of the standard operating procedure is to guide the COVID-19 response team in conducting contact tracing. Objective, to expedite the tracing of close, sorry, probably it's just gone up a little bit too much. Yeah, that's fine. Possibly infected with COVID-19 are indemnified and monitored appropriately for their well-being. At the risk of contacting, sorry.
I got it. Keep going.
At the risk of contacting COVID-19 are monitored to ensure that they are aware of the symptoms for self-monitoring and appropriate actions available. Point number 4, definitions. A probable case, a person under investigation, PUI, for whom testing for SARS-CoV-2 is inconclusive. A confirmed case, person with lab confirmation of SARS-CoV-2 infection, irrespective of clinical signs and symptoms. Case types, laboratory analysis required to identify a primary case, the individual who infects others, and an index case is the patient in an outbreak who first noticed by health authorities. And then we're looking at contact, a person who has contact with a confirmed COVID-19 case in the last 14 days prior to the case patient onset symptoms. Close contact, a devotee having had face-to-face contact less than 2 meters or was in close environment with the COVID-19 case more than 15 minutes. This includes, amongst others, all devotees living in the ashram or house who has a COVID-19 case and devotees working closely in the same environment.
This includes, amongst others, all persons living in the same household.
Household as a COVID-19 case example, spouse, child, domestic assistant, etc. And people working closely in the same environment as a case, colleagues, friends, and classmates. A healthcare worker or other person providing direct care for a COVID-19 case while not wearing recommended PPE. Example, gowns, gloves, certified disposable N95 respirator, eye protection. A COVID in an aircraft sitting with 2 seats in any direction of the COVID-19 case, travel companions or persons providing care, and crew members serving in the section of the aircraft where the index case was seated. Casual contact, anyone not meeting the definition for a close contact, but with possible exposure to a COVID-19 case. Point 5, when to initiate contact tracing. Identification of contacts and contact list forms should be completed for each person under the investigation at the time of intimation or confirmation by the temple designated COVID-19 official or safety officer. Point 6, stepwise guide to conduct contact tracing for COVID-19. Temple should have a COVID-19 team. The team must have a focal person who liaises with temple management and supervises team activities. Interview the index case person. Record the responses on the contact tracing form for the past 2 days before the symptoms arose. Define nature of contacts during this period. Close, casual, or distant. D. Contact persons listed in the C above. E. Repeat sets A to D as far as the temple scope. F. Monitoring of inferred COVID-19 exposed individuals. 7. The monitoring process by the COVID-19 team. A. Close contacts will be monitored telephonically by the temple COVID-19 team 14 days post last exposure to the confirmed case using the COVID-19 exposure screening and monitoring form. Temple COVID-19 team will be expected to submit daily reports. That is the COVID-19 exposure contact tracing form. And COVID-19 exposure screening and contact and monitoring form to the temple management. C, should develop a contact.
Make comments as we
Yes.
go along, if you don't mind. Yeah.
Yes,
So
yes, go for it, bro.
I think later on you mentioned by telephone, but there's a place where 6A, interview the index or case person. I think it would be good to mention there by phone rather than in person.
Okay, so interview the index case person telephonically. Bro.
Preferably by telephone, so that
Telephonically.
doesn't give the impression you have to go and actually speak to him to keep your exposure down.
Correct. Absolutely.
I think later on you mentioned that. It'd be good to just put it there also.
Okay, bro.
And then,
No, we'll add that on. Definitely.
Thanks. So B, record the response on the contact tracing form for the past 2 days. So I think that 2 days is correct. I just looked up the CDC thing. So they're looking
Yes,
2 days back before the symptoms arose. So I think that's correct. I just wanted to go a bit further back into an earlier place. So somewhere you say case patient something.
Oh, those are the definitions, bro. Like a contact.
So I found that a little bit
These are the case steps.
confusing. Which line is that? Let me just try to look it up again. Contact. Yeah, for contact. Definition.
4, yes.
4. Yeah, and then contact. A patient who had contact with a confirmed COVID-19 case in the last 14 days prior to the case patient onset symptoms. Those words there, those 4 words, is kind of a little bit confusing to me. And I'm guessing as a medical personnel, if I'm trying to find out what it is, then might come about confusing to somebody else as a layman, because this is what this document is intended for.
Correct.
A layman.
Absolutely.
So what
Correct,
are you trying to say? Case patient onset symptoms. Just can you clarify what are you trying to say?
Yeah. A person has confirmed COVID-19 case in the last 14 days. I think what you said is true. We'll take that whole line off, Prabhu, because basically we're looking at a contact. And then,
just simple language.
anybody's been...
Case patient onset sounds like a terminology and people scratch their head. What is that trying to say?
Correct. We'll take that out then, Prabhu.
Okay.
I think we'll just mention a person who had contact with a confirmed COVID-19 case in the last 14 days.
Yes.
I think that clears the confusion, So
what do you think?
Clear
Prabhu,
for
is
the...
agreeable to you also?
Vinny,
Yeah,
you were happy with that, perhaps?
I agree. It's confusing. But let's just fix it now. So a person who had the contact with confirmed COVID-19 case in the last 14 days prior to the, because this is repetitive, right? Because a person who had contact with a confirmed COVID-19 case in the last 14 days, can we just leave it there? Can we just
Yes, bro.
Can we just leave it?
Okay. That would be good.
That would be great, Prabhu.
Okay. All right.
And then somewhere it says certified disposable N95 respirator. Do we need to have all those terminology or just keep it simple?
I think we need to let's just modify it and keep it simple, Prabhu. Because from
N95 mask.
Yeah, N95 mask would be better than respirator. People wonder what is a respirator.
Let's take the respirator out. Correct.
Is M capitalized here? I think
N is capitalized, yes.
No,
yes,
N,
capitalized, bro.
I get N, but what about the M? It's because it isn't an N95 mask, so we're gonna capitalize the M, right? Because it's a
Oh, where is the M? There's no M there, right?
N95 mask. We're
Yeah.
capitalizing.
Oh, N95. Oh, like mask, it doesn't matter. M
Okay.
is small. It's better in graphically.
Okay, good.
So in India, you may also have the KN95. So if people are confused, we could add that also, the Chinese variant of N95.
Okay. N/K.
That's fine.
Yeah, that'll confuse me for sure. We'll say N95 or K95. How's that?
Yeah. I think it's KN95, right? Do you think it's K or KN95?
It's KN95, bro.
Fine.
Okay.
So N95 or KN95.
Right.
Perfect. Okay.
Okay, that's all I had for now. Keep going.
Contacted in an aircraft sitting with 2 seats in any direction of the COVID-19 case, travel companions or person. Okay. Next, you were right here. Right here. 14 days. You're at 7A.
7A, right.
7A is the close contacts will be monitored telephonically by Temple COVID-19 team. 14 days past exposure to confirmed case using the COVID-19
COVID exposure
screening and monitoring
form. Perfect.
And then Temple COVID-19 team will be expected to submit daily reports, COVID-19 contact tracing form, and COVID-19 exposure screening and monitoring form to the Temple management. Why are they doing this over and over again?
I think this is just the process for the COVID-19 team at the temple, based at the temple. So the temple authorities need to be informed on a daily basis. What's the stats?
Expected daily reports, but not redundant. I guess the daily reports, but they don't have to keep interviewing the same patient over and over again.
No, not at all.
Reports,
Just
regarding new potential suspects or
regarding new potential suspects or suspects, probably.
Not really great verbiage. But anyway, new potential suspects, COVID-19 exposure tracing form, and COVID-19 exposure screening and monitoring. Okay. And then, should a contact develop symptoms, the temple management should be informed immediately. And then the temple management should submit details of the contact who developed the symptoms to
the local authorities.
Individuals not meeting the definition of a close contact, but with possible exposure, should be informed to contact their healthcare practitioner if any symptoms develop within 14 days since exposure to confirmed COVID-19 case. Yeah, this sounds
that's it.
Pretty solid. Okay, so you want me to save this and send this back to you?
Yeah, that would be fine, Prabhu.
I'll save as. What am I saving?
You can you can title it the COVID SOP peer review, Prabhu.
Just have to see where I'm going. I am in my computer. Oh, okay, this is not my computer. All right. Desktop. All right, and then let's see. All right. It's just not allowing me to go. So hold on one second. All right. Okay. COVID-19 reviewed contact tracing document. We're at October 24th, 2020. All right, resume share, save, and we'll send that off to you after the meeting is done. Or do you need it now?
No, later on, it's fine, Prabhu. After the meeting is perfect.
Okay, do you want to, is there anything else we need to do?
No, just we quickly look at the flow sheet And just we quickly look at the documents, just a quick quiz at it to see if you're happy with it.
Flow diagram.
Yes, bro.
Share flow diagram. Share. That was what I wanted to do. I think. Can you see the flow diagram? Yes or no? Yes, you can. Okay. So initial screening. The person's listed on the contact. Risk assessments. Evaluating. So I guess screening, evaluating, monitoring, development.
Yes, bro.
This is the case. Investigate who they came in with.
Yeah.
This is much better for me.
Yeah. No, this is a quick upload that we did, so that if anybody's at the temple and they're confused, this is an easy, quick system they can evaluate the case that they've got. Are you all happy with this document, Prabhu?
So I looked through this document. I had some problems with that, again, trying to understand some of the concepts in the first two lines. When it comes to the orangish boxes is fairly clear. I can go down it, but the first two lines I was stumbling a lot and trying to understand what you were trying to say. And I don't know if that can be simplified to take out a lot of the unnecessary thing. I mean, flow sheets need to be simple with a few words, and I think it's a consequence of trying to condense what we are saying. But still, most of the people will look at the flow sheet rather than reading long texts. And
Correct.
we need to just define what exactly is going on at the bottom, and then keeping the words minimum. I'm not sure if the first two lines need to be there. What is it that we're trying to convey in that?
In the first two lines, it is the aspect of screening, Prabhu.
Persons, flow diagram for contact. Initial screening listed on contact one of the list. If you go to contact one, here also contact one, that case patient onset is coming up again, which I had problems trying to digest that. At the bottom, at the fine print.
Yeah, that was the case definitions. We repeated again. In the event if one of the devotees at the temple or the safety officer is unclear about definitions.
Yeah, that needs to be there. I agree. I was just thinking, do we need that case patient onset symptoms again there? Or just say a person who had contact from COVID-19.
Quiz at the bottom of the flow chart, and he'll be able to see what is a close contact, etc.
I think this makes sense. I think this makes sense. Monitoring for 14 days, stop all the way through, monitoring of those at risk. Symptoms develop, no symptoms develop, then stop. The question, are we really going to monitor for 14 days? If symptoms develop, obviously we're going to, and then is it really a monitoring for 14 days for those of casual contacts? If you're at risk, and you do a 14-day monitoring. Because what my question is, for example, Amrit Madhav just flew here. He's downstairs. Are we really doing a 2-week quarantine for him, or can we do like a 1-week quarantine or 1-week retest?
So in my opinion, the 14 days is what it is. The incubation time is from 2 to 14 days. What people are doing now these days is they try to test you around 4 to 6 days time frame. The later the better. And then if you're negative, they say, okay, you're probably negative because that's the average incubation period. Most of them would have tested positive, but there is still a theoretical risk that you could turn positive in the 14 days. You still have to be careful in that 14-day time frame because you could have a late incubator. So if you want to be really safe, and in the case of Guru Maharaj, I would say we have to be really safe. I would say 14 days. For the average person, again, it depends on how much you want to take it. It's very restrictive for 14 days, I agree. And you are kind of trying to, it's all risk mitigation. Most likely, the major chunk of the risk is mitigated by just doing, let's say, a 5 or 6 day quarantine screen, and if negative, just monitor for symptoms for the rest of the time. It doesn't rule out those persons who are asymptomatic. As you know, 40% are asymptomatic, and they're the real super spreaders. So that event could still happen.
Okay, it's just the practicality of doing the 7 days versus the 14 days. We'll see if it's really practical to do the 14 days. I know everybody on the group wanted it, but I think the ground reality is people are pushing for that to be 7 days.
Right. So that's what is happening currently in most of the places. They test there, but people forget that, oh, I'm tested, I'm negative. And then these people, they just go out and think everything is okay, when in reality, that is not the case. A small proportion of them will turn out to be positive later on. And these are the ones who go around spreading. And from an ISKCON perspective, for Guru Maharaj, I would definitely say 14 days. But for the ISKCON, you can either give it as a choice to them, or you need to just, do it the way it is supposed to be and be strict about it, which is my preference, actually.
We'll try. We'll see if it works. My thought process is he arrived on the 23rd, and then I was saying that November 6th is probably the right day to be able to let him out. So what does that give us? 23rd to the 31st. That gives us 7, 8, and then 8 plus 6. So I said November 6th on the group. Let's see if that's actually practical. I think more of the other people wanted him to be able to be released on the 1st of November, and so that way I would I'm trying to get a ticket by let's see if the flights reopen. But I'm trying to get a ticket. Let's see. Wow, my phone just. Can you see my phone? Are you able to see my phone?
Yes, bro.
I don't know if you're able to see my phone. Sorry, just a little disclaimer here. My phone just will talk randomly, so I don't know why. But I broke the phone. So half of the phone here is what's it called? Half of the phone is broken. I don't know if you can see it. I'm not sure that you can. Half of the phone is broken, so it will randomly talk in the middle. So anyway,
it looks like a case of haunting, Prabhu. It's Halloween season.
It's so crazy. It'll just talk in the middle, and then I can't get it to stop. So, all right. Anyway, so
Yes.
yeah. So I think I agree with you. So the thought process is then I guess monitor required for 14 days. Same thing as and then symptoms develop, and then if they do, then you do an investigation. You treat them, and then you treat all the contacts. So the question is it avoid non-essential contact for casual contact? Have we defined essential?
We defined it as close contact, casual contact, and distant contact, Prabhu.
No, I got it. But what does non-essential contact mean? Avoid non-essential contact. Like, what's essential versus a non-essential in this case? Like, whatever's critical for these patients. I mean, have we quarantined? Because you said self-quarantine for your close contact.
Yes.
Have we self-quarantine? Kind of, because that's where it just becomes like, say you have the same thing here. You say, bro, like only avoid non-essential contact. That guy's just going around everywhere, right?
Right.
Only what you think is contact. Well, I really had to go talk to my friend. So when my question is, have we defined that? Have we really defined that and structured that?
I don't think we've defined that as yet, Prabhu, but we need to look at it.
Maybe you can if you'd like.
Yeah.
But I love the document. I understand it much more than I understand the text. It really flows for me because I can see the big picture.
Yes.
I'm impressed with your work.
Okay, no, that's fine.
What's the next document?
Thank you so much. This is just some of the stuff that we.
Can I just?
The next document is just the forms, Prabhu, the contact tracing forms.
Okay, so go ahead.
Something of previous form.
Yes,
so
go ahead,
there are two concepts there. So quarantine is typically 14 days from contact. There's also the concept of isolation, which is if you have symptoms. Can you hear me? Haribol?
Yeah, I think we're losing Vikram. I think we're losing. He has that South African internet.
Vaishnava Pram Prabhu, are you able to hear?
We can hear you. Go ahead, bro.
Oh, okay. So I think there are two concepts. One is quarantine, which is like 14 days from the contact. Other is isolation, which is if you have symptoms, you isolate yourself. And
Go ahead.
that is 10 days from first symptom, or 10 days from the date of test if the patient was asymptomatic, providing there is no fever for 24 hours and symptoms are getting better. So you might want to bring that out also. People might ask, if somebody is positive, how long do they need to be isolated for?
Okay, I'm not sure. Are you taking notes, Vishnu Prabhu? Because I'm certainly not right now.
Yeah,
So,
I'm back on track, bro.
okay, perfect.
I think
Okay,
I
did
was
you
having
hear what I
loss of connectivity.
Okay.
Okay, I'll
Could you
repeat what I
repeat
said.
that again, please, bro?
Yeah, sure. So I said there are
Yes,
two
bro.
concepts here. One is quarantine, which is meaning that if you have contact with somebody, then the time period you're going to stay away from others is like 14 days. And the second concept is isolation. Isolation is if you have symptoms, and I think that needs to be also brought out because people might ask you, how long should people stay away if they have some symptoms? So isolation is 10 days from first symptom onset, or
Yes,
first positive test if the patient was asymptomatic earlier on. And there are also two
that's correct,
caveats that
bro.
providing there is no fever for 24 hours and symptoms are getting better. So that's how long you isolate yourself. That might need to be written somewhere into the document.
Okay. Muralidharan Prabhu, when you've got some time later in the day, can you just send us a quick email about these points? And
Okay,
I'll try
okay,
and capture it in the document.
okay.
Yeah.
Sure, sounds good. Okay, we can go to the next form now.
All right. Okay, so it's gone. Let's see. COVID-19 exposure contact tracing form. Details of inferred/confirmed COVID-19 case. Probably want their WhatsApp. You have their phone number. I'm not sure if email would be
Yeah.
useful.
May not be useful.
May not be
This is for the tempo,
Yeah,
just to document the visitors that came in.
text each other. Email is not a very useful thing anymore.
And this is the exposure and screening monitoring form. It just asks them questions, when they walk in. The date that's there, of course, the name, etc., of the contact, the place of contact, and more importantly, the symptoms, temperature, whether they have cough or chills, sore throat, etc. And it's a tick box, yes or no.
So I had a
And
few
if they
comments.
didn't,
Sorry,
go ahead, bro.
Okay,
So,
so
go ahead, bro.
so we have kind of separated the symptomatology. I'm not sure if that's intentional or what is the purpose it is going to serve. I can see some purpose in it. For some of the symptoms, if you lump it together, it tells you, oh, is this some other kind of viral illness? Like if you're having mainly diarrhea, then you might want to think, could it be some other disease rather than COVID? So in a differential, it might help. And I think you need to add vomiting also, which is one of the symptoms that could probably
Perfect.
be
Yes,
added
bro.
to diarrhea. You can lump it together.
Yes.
And the other consideration I had was maybe you can lump like sore throat with runny nose. Runny nose is missing. That might
Okay.
tell you about like URIs. And then chills is a fair comment. It's a subjective thing. You might want to have it. Cough is definitely there. Shortness of breath is there, myalgia, body pain, and you might want to add headache to that also, because headache can be an isolated single symptom,
Yes.
and that's a neurological symptom
Correct.
also. The other thing crucially missing is loss of sense and loss of taste.
Yes.
That needs to be there.
No, I agree with you, bro. Definitely.
And then you also might want to define what is fever, because classically fever is 100.4 or 38 centigrade. But for COVID screening, they are lowering it down. Some places use 100, some places use 99. And you might want to spell it out for them.
Okay. No, that's fine. We'll put that in the document, bro, as an additional.
Okay.
Can you send those comments through, please, Prabhu,
Yeah. Okay.
on when you got some time, and then
Yeah.
we will edit the document
Sure.
accordingly.
And also somewhere I think you mentioned in in the fine print, like contact less than 2 meters, out here 6 feet. Minimum, I mean, it's arbitrary. Actually, the risk extends for, much further than that, but these are arbitrary figures. 15 minutes, I think it says somewhere in a closed room, but I think the CDC doesn't mention anything about closed rooms. It just says 15 minutes contact, I think. Doesn't necessarily have to be a closed room. Of course, the risk is more in a closed room. But if
Yes.
the closed room is somewhere, I think we might just take it out just to make it a bit more all-inclusive. Otherwise, people might think, oh, I was talking to them outside.
Yes.
And I don't have to have any botheration. And that is, of course, without a mask and other PPE, etc.
Yes. Correct, Prabhu. Without the PPEs, definitely.
Okay, that's all I have.
Is there anything else? Okay, thanks, Muridharan, Prabhu.
I'm wondering if
Vinay, Prabhu.
Yeah, as far as just the practicality, you have around, this is worldwide. So I'm thinking you have 700 to 800 different facilities. I think over 1,000 facilities now, right? 1,000 facilities across the world, as I understand. So
Yes.
you're creating the standard work. My real question is when I've seen other people ask these questions of people, are you feeling chill, cough, sore throat, all of these things? The longer you run this list, the practicality on the ground versus the reality, unless you have a doctor that is running these things, I don't think that this is a practical form, quite frankly. Just because I know what it's like going into Guru Maharaj's room. I know what's there. Are you feeling sick? No cough, fever, cold? That's it. You're going to get 3 words, and that's basically it. So when you run these contact tracing forms for people with contacts, especially with these people, I mean, we talked to these brahmacharis online today, Vishnu Prabhu. These people are pressed for time.
Yes.
Their schedule is insane.
Absolutely.
3 o'clock, and then going till 10 o'clock at night, and then waking up back at 3 o'clock. I mean, really, really hardworking people at the age of 40. I just don't think it's practical. So I think that when people are getting sick, when they have a cough, they have a fever, they have a cold. So that's my only thought process is it's a fine feasibility study. Let's see.
Right.
So I agree with what you're thinking, Vinay Prabhu. That is the reason for my earlier comment. Do we need to have all these separate? So that's why I suggested you lump it together into symptomatology groups. I think we need to spell out what are the symptoms, because people say sick. So what is sick to a person? It might be different for different persons. And I presume somebody is asking these questions to somebody. So it's, especially when you go to a doctor's office, it's the same. You go to a patient, you ask them sick. Most people don't want to think they're sick, and they don't say that. But you ask them specifically, did you have a headache? Did you have vomiting? Did you have sore throat? Oh, yes, I had that. So I see the concept of time being a constraint.
But what I'm saying is it's not practical on the ground. And if you have any idea of ground reality, this is not going to work, because we're trying to be efficacious here. So
no, I'm aware. I mean, every day we have to fill out a COVID form to go to work. Everybody does that in hospital.
We're in tempos.
You have to go through the symptomatology. I agree, it's time consuming. But if somebody is asking this to somebody, I believe somebody is asking these questions to somebody, right?
What I'm saying is I love the process improvement. It's just not practical on the ground. So what I'm trying to put across is there one question we can ask our patient population? Is it possible to achieve the task that you want to achieve? Is there a question that we can ask, like, are you feeling different? Is there a Vaishnav type question that you can ask that captures all of this in one question? And that's the $1 million question, I believe, because I don't think it's practical to run this list, because I'm running it every day and I see what happens on the floor, and it's not practical. So for example, if you have these pictures above or anything like that, that's it. And I'm guaranteeing you, Vishnu Prabhu, it's
yes, bro.
you know the schedules. and people are running around.
Right.
They're running around like people are running around with a cough, and you catch them, and you're like, "You're having a cough," and they're like, "Yes,
Right.
but it's just because I have air conditioning," and you're like, "No." Right? And so because it's also inferred reference too. You're having a cough. Well, I'm having a cough because the air conditioning isn't good, or I have a runny nose because I'm constantly being bombarded by this. And usually in this season, I get this. An example is today we just saw one patient. I'm in Nepal, and I asked, his father has COVID-19. His son is sitting there going to him, and I said, "You have a cough." He said, "Well, I'm in Nepal. It's cold." Right? So that thing
Yes, bro.
is there. So what I'm saying is that practical aspect, oh, you need to get tested. So I think we're saying the same thing, but what I'm saying is that when it's there and it's not a medical practitioner doing this, there's that authority gradient isn't there. And because that authority gradient isn't there, or the effect of the medical practitioner isn't there, how do you reinforce this? That's my real question. And so I don't have the answer. I'm just saying I know that it's going to come down because I've been on the ground for a good 9 months, and I know that this is not a practical process. I just know it because I know the point.
No, it's true.
It's not.
I think what you mentioned is an important point. How can we succinctly ask just maybe 2 or 3 questions the most to get the maximum impact?
Yeah.
I think one of the things we need to look at is loss of smell or change in taste. That's one of the questions I'd like to change on this document. Because if they've got loss of taste or change in smell, etc., there's a high index of suspicion immediately. That's the first thing I was thinking of, Prabhu.
Yeah, I think if you ask that one pointed question, or if we can come up with one question that is different that will trigger us, that would trigger our population and say, "Oh, yeah, no, something's different." Like, do you think you could be at risk to another Vaishnav? See, that hits that. If you think of yourself, is it possible that you're at risk? Because that's one thing that runs throughout the community is nobody wants to cause harm to another person, and that's a personality trait that's usually there. So if we can hit upon that emotional factor, I think we'll reduce our workload, and I think we'll actually have penetration.
Absolutely. Vinay Prabhu, I think that's an important point you mentioned just now.
I'll send it on.
When you just print it up, just when you're sending the email, just flag those points. Because when I meet with the SPS team later, by tomorrow or so, I'm going to flag up these points and say, look, we need to maybe relook at the document and rechange it. And I think that's important.
Okay.
So Prabhu, who is going to do these? Somebody is asking these questions, right? A lay person is going to ask those questions to somebody, or the person himself is going to fill the form?
No, Prabhu. It will be done telephonically generally by the COVID safety officer at the temple. Who's had training, who's been inducted into the process of what he should be alert in respect of the signs and symptoms, the danger symptoms. So they would be filling in these forms. And specifically, it's meant for people who are coming to the temple. Like different temples have a different context. Some may have devotees who are congregational members visiting the temple to do service. So these forms specifically, when they enter, they'll be filling this. The safety officer will telephonically speak to them. And if they're safe, then they come into the temple to do their service. But the minute that they have any symptoms like fever, etc., then we'll tell them, you take a breather for at least 10 to 14 days, and we pull the next team in to cover that service. So that's what we're looking at in this context, Prabhu.
So in our hospital, what they say is, like Vinay Prabhu was saying, you might be having chronic allergies, or you might be having chronic bronchitis and you're coughing. So they put a little qualifier there. Do you have any change of symptoms different in the last 24 hours, which is different from your usual state, like chronic runny nose, chronic cough? So something different from that. So they kind of qualify it so that you're not screening people who have some chronic symptoms which looks like COVID at this point in time.
Correct.
I take on board what Vinay Prabhu is saying, but I still think if somebody is reading it out, you need to mention the symptoms there. You don't have to put them in each line, each one. That is a bit long. So that is also my initial thought process is too much. But you could lump it under symptomatology, like a few things together. You put it there.
No, definitely, Prabhu. We'll go ahead and make those changes. Yeah. Anything else you want to suggest, Vinay Prabhu? If you've done Muralidharan Prabhu, if you're over.
Great effort, Prabhu. Thank you for sharing and thank you for including me.
Thank you, everybody. Thank you, Vinay Prabhu, for this tremendous effort.
Thank you. Yeah.
Vaishnav Prabhu.
And
yeah,
thank you, Prabhu. And enjoy your day at work today, Prabhu.
Very well.
I will. I will.
I know it was definitely a full day. We still have 4 more patients, so
Oh, Krishna. Oh, my Lord. Govinda. And just to share with you before you go offline, bro, I'm not sure whether Srinivas Prabhu is taking his insulin appropriately, because you told him, are you taking it as we said? And there's been no like feedback from him,
Yeah, it's also
It's
uptake,
difficult with him.
trust, and all this stuff. It was fun. We just had we had one patient who the dentist. I think the dentist didn't see him directly, but had offered antibiotics, and it was a reasonable request. But because he didn't see him, so then we set up the online appointment, and then he came over to my my office, and then I just posted it on the group. I posted the cavity on the group, right? And then he said, yes, I'll take the antibiotics, right? And so it's that in-person touch that I think that some of the telemedicine stuff, I think the telephonic stuff isn't taken into account, but I think the telemedicine has to be done in a way where there's a trusted person that's on the other side, on the ground, that actually helps.
Yes.
Look, this guy's legit, just give him a chance, I think that trust factor is absolutely key, especially for uptake. So I think Muralidharan Prabhu mentioned a good point, is that person that's reading out, or the officer that you mentioned, that officer, that person has to be just a trusted person, like a Mahaprabhu on the ground, or that
absolutely
feels like they can count on, because that's absolutely key.
That's true, bro. Absolutely.
All right, I got to go figure out. Okay, so I got to go read about it, because it's not usually what I see.
Yeah. So Prabhu, today I will look at, we have different hospitals. So one of them, I know it's like a long list, and I just click, it's like muscle memory. You just click through the none. So, you'll get to the green kappa and entry card point. One of them is long and one of them is shorter. I will see what are they asking, which makes it a little bit shorter, and try to see if I can incorporate them in the suggestions. I agree with what Vinay Prabhu is saying. I agree, but then I think we also need to have the data available for the person asking, because it's a lay person. He needs to know. So, okay. Over.
Yeah, no, that's fine, Prabhu. Over. Thank you. So if there's nothing else from anybody, can we close this meeting?
Please.
Yes, Prabhu.
Okay, thank you so much. Dhanyavad, Prabhu. Good reception. Prabhupada ki jai, Guru Maharaj ki jai. Hare Krishna.
Hare
Hare Bol, Hare Krishna. Hare Bol.